Even if you can't remember if it's 15 compressions or 30 compressions, just doing something and getting things going and getting that blood flowing between the heart and the brain is the major thing to do. When I first started taking CPR, they were like, oh, you could hurt somebody. But all the research is saying exactly the opposite. So if you start doing compressions on somebody and they don't want you to do it, they'll find a way of telling you, don't do that to me.
You know, you talk about saving a family member, and I think you probably just, it's that adrenaline. You would jump in and do what we know we need to do, and then you fall apart and cry afterwards.
So the main thing is to make sure that that person is safe, get EMS coming as quickly as possible, and then whatever knowledge that you do have, you know, it's mainly just keeping them safe, keeping them breathing. You know your CPR. Anything else, you can't think that you would be able to diagnose it.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, an Endeavor business media production. This is episode number 366. I'm your host, Andrew Johnston, and boy, howdy, do we have an episode for you. Today, we revisit the topic of CPR, but we do it in a little bit different of a way. In this episode, I welcome Debora Carrier and Jackie Sanders to discuss real-life situations that they've experienced with CPR and some medical emergency situations. It's pretty darn fascinating. And we talk a little bit about if you are overdue for your CPR training, how can you do that via Debora's course? Essentially, it's distance learning, but we get into a little bit more of that and how that applies. And then next week, we'll have an episode on artificial intelligence with Anne-Marie DePalma. We welcome her back. It's been a long time in getting this episode coming. We've been talking about doing an episode together for almost a year now. So I'm extremely happy that we were able to get that scheduled and it finally happened. AI is coming to all of your operatories, whether you like it or not. So hopefully this episode will teach you something and you'll be a little bit ahead of the curve and be ready for it. And I just wanted to share a little bit of my experience that I had last weekend. We made a last minute decision for me to attend the Dental Hygiene Seminars board prep course in Chicago, and it brought back all sorts of memories for me. And I don't recall the company that we used back when I was a student, but I do have a little bit of flashes of that memory. I remember there being a hotel banquet room or banquet hall with hygiene students across the state of Washington in attendance. And I feel like most of them were from the Seattle area, and then we were coming from the Yakima area. I remember that there was a nervous energy because no one really had any idea what to expect. None of us have ever been to a board review course before. And of course, we sat towards the back because that's how I roll. And I remember meeting a couple of other people from, I think it was like Washington Technical College, maybe Seattle Central. And we were comparing notes on some of the requirements that we had to do, some of the things that we were working on. I remember some of them were working in actual dental offices as kind of an externship thing versus what we were doing. And I just remember the first time in ever that I felt like this was a profession that was bigger than just school. Because of course I knew that there's a whole profession out there, but I think growing up, I always thought of professions that you go, you get your education, you graduate, you find a company to work for, and then there you are by yourself doing your own little thing. Little did I know how integrated the hygiene profession really was. And this was kind of my first glimpse into that. So going to this prep course, which by the way, this was much larger than the one I went to. There were hundreds of students in attendance in this huge conference room. Again, a really great experience for me. I caught up with several of my friends, which was fun. One of them you're going to hear today on the podcast, Deb Carrier. And I met several new friends. One of the things I did cherish about the visit is that I did see the look of innocence on the faces of all these little baby students. And I could tell that they felt both nervous and excited for their futures. I also felt nervous and excited for them because there are so many things that are different. We actually talk about this in an episode coming up in a few weeks. We have a roundtable where we discuss the kind of plight of the COVID student, the people who have gone through school in this COVID and post-COVID era. What was it like for them? The educational landscape has really changed. And what did that mean for the graduates? So stay tuned for that one. I think it's gonna be pretty interesting. And one last thing to mention, as kind of like a side note, I could totally tell who the goody was for each of these classes. I think you guys all know who I'm talking about. The person who's like really smart, like super serious, really focused on school, and wants to be recognized for being like the most serious student and the best student. Conversely, I think I was able to tell who the Andrews were in each of the classes. The one that has like the nervous talk, the one that takes the profession seriously, but also knows that like an exam isn't life and death. And maybe they took a little bit of a nap during their radiology course when the lights were turned down a bit, maybe, just maybe. So it was fun to see, the different types of personalities that they still exist in the schools. So this coming up week, I will be at Voice of Dentistry. I think it's the 6th year in the row that a Tale of Two Hygienist has been there. It also happened to be kind of last minute. So I just booked my hotel and registration, all that kind of stuff just within the last couple of days. A big thank you to Dr. Alan Mead from the Very Dental Podcast for the invitation, also the follow-up, and also making sure that I could swing the trip. He was very, very kind about, making this happen for us. So if you are interested, he has a great podcast too, the Very Dental Podcast, one of the highest rated ones in dentistry. If you feel like something your doc would really benefit from, steer him that way. The thing I like about his show is that it's like the everyday dentist discussion and it's not completely unrelatable. So if your doctor's not doing implants, well, you're not going to be having 30 episodes just on implants. If your doctor's not doing high-end cosmetic dentistry, it's not going to be just that. He takes everything and discusses everything with the experts. So if you are so inclined, make sure you send the link over to your doctor for Dr. Mead's show. I think that's it for me today. Thank you so much for everything. I hope you enjoy this episode with Debora Carrier and Jackie Sanders.
A Tale of Two Hygienists.
All right, welcome in everyone to another interview portion of the podcast. Great news. No direction again for this show. So I'm lucky to be joined with Debora Carrier and Jackie Sanders. Thank you for being on.
Thank you for having us.
Thank you for having me.
Are you intimidated by not having a direction for this?
Absolutely not.
That's when it's most comfortable.
Well, I was telling Jackie actually before we actually do have a direction for this. I think why I wanted you to come back on, Debora, is because one, you've been a recurring guest over the many years.
Mm-hmm.
Two, I am due for CPR again. And I was trying
to
hope
was an
for some sort of like
motive
a barter system. Like let's promote your CPR course, and then hopefully you guys can put me at the top of your priority list to get my next CPR.
Right, we can do that.
Jackie, when was the last time you did a CPR course?
Sitting here talking about it, probably it's been at least 5 years.
Yeah.
Yeah.
The last in-person one I did was probably 2018, 2019.
Wow.
And it's a requirement for all the states, right? To get your license and stuff. And it's so hard when you're not working in an office regularly to be able to get in and get the requirements taken care of. And I always put it on the back burner until it's like right when it's due again.
Which is what everybody does. And more importantly, besides needing it for your license, you need it in case one of your loved ones just happens to fall over, and the guidelines have changed and it's a lot easier than it used to be. But unless you have that repetition, when it comes right down to the time to have to do it, you really need to be up on your skills. So.
Well, it was all over the news in the NFL, right? This last couple of weeks.
Yes,
of,
absolutely.
The player from the Buffalo Bills that got, hit and needed some CPR on the field to sustain his life. And I don't know if this is a controversial take on this. They talked about I can't remember what his role is, but he was the medical professional that administered CPR, and they talked about what a hero he was. And everyone's just like gushing over this. I'm like, wait. No, that's his job. It's like like a dentist doing a root canal. Like that's what they do all day, every day. Like that's what they train to do. Like they're ready for this thing. But the fact that he was able to do that, like on the spot, can you imagine the pressure of 30,000 fans or however many fans were in there looking at you doing that?
He was actually the assistant trainer.
Yes, that's exactly
so
what
he was the first one off the field to be by his side, and he could tell he wasn't breathing, and he just jumped in and started providing care.
When I first started my company, I immediately was connected with 2 moms who had lost their children to sudden cardiac arrest. And the night that happened at the football game, she texted me immediately as she had been watching the game. And we both knew what had happened. There was all the speculation about what exactly happened. We knew that he just got hit at the wrong time and it sent him into ventricular fibrillation. And what made that guy a hero is there was no hesitation. He had to get out there. They had to start CPR immediately. And then as soon as they could get an AED on, get that on, and then you'll have great results. And so when everybody was talking about it later that night of, oh, we've got to pray for him. Is he going to be okay? I knew he was going to be okay because I knew how fast they got to him, unless there was some other underlying heart condition we didn't know about. But knowing the circumstances leading up to it and what happened, I was like, yeah, he'll be in a coma for a few days and then he's going to be fine. And that's exactly what happened.
This is the difference right here. The expert Debora versus me, where I'm like, no, I would look like, did he crack his sternum? Like, what?
Right.
Let me look for broken bones first. So maybe for our listeners, like, can we, I don't want you to give your whole course away like in this, but can we kind of go through that assessment phase though a little bit? Like, what, very maybe specifically to this football player, but anytime you come upon a scene, like, what are you supposed to look for?
So the minute you come up on a scene, the first thing before you come up on the scene is you want to make sure it's safe for you. So before you run in there, which is a lot of people don't take that 5 to 10 seconds. And there's that rule, at least 5 seconds, but no more than 10 seconds to assess the situation and then move on to the next step. Okay. And that doesn't waste any time. And so you do that and then you get in and immediately, if you recognize there's not responsiveness, you're going to yell for help. It doesn't matter whether they're breathing, whether they have a heartbeat. At that point, you just want backup coming, because without backup, even if you're an amazing CPR, with your compressions, you're still not going to get the results you need. So you need that backup coming, and then you assess and you just, look and see if they've got a heartbeat, if they have breathing. If not, just jump right in and do CPR. And even if you're not sure, just go ahead. It's better to do too much than not enough. So that's pretty much the basics of it. And even if you're not, you can't remember if it's 15 compressions or 30 compressions, just doing something and getting things going and getting that blood flowing between the heart and the brain is the major thing to do.
Is that a relatively newer change, like within the last decade or so? Because I feel like it was, when I first started learning, it was like, look, if you're not sure, don't do anything.
Mm-hmm. Yes. When I first started taking CPR, they were like, oh, you could hurt somebody. But all the research is saying exactly the opposite. So if you start doing compressions on somebody and they don't want you to do it, they'll find a way to tell you don't do that to me.
And there's no legal repercussions if you make a mistake or anything like that?
You are covered under the Good Samaritan law, both at the state and the national level. And it doesn't mean somebody can't attempt to sue you. But it's never going to go anywhere unless they can prove that you intentionally tried to harm them. So even if you do everything wrong, like you do 30 breaths and 2 compressions, as the only thing I can think of is if you took the defibrillator and hit him over the head with it, then that might be a lawsuit.
Lay there, be still. I'm trying to help you.
Exactly.
Like, no, I'm fine. Duh.
But otherwise, never let that kind of stuff stop you from trying to help somebody.
Have either of you seen a medical emergency in the dental office?
Yes, I have.
Yes.
Really? Tell me more about that.
Yeah. The one I remember the most is a young man went into an epileptic seizure in the dentist chair. And because I have a lot of experience with a family member who has epilepsy, I knew what to do. So I immediately heard him yelling my name down the hall, Jackie, get over here. And so that was, the adrenaline kicks in, you know what you're supposed to do, you get it all done, you get the person safe, you make him protected, and then you collapse at the end. You go back to your operatory and you're like, I am going to be sick.
Yes, that's exactly what happens. And that's what I tell all my students. You're going to be fine during the episode, but afterwards, it's hard.
Yeah. You're talking about when did I do CPR last, and I was a first responder when I worked at Sunstar, so we had to take it every year. And this wasn't a life-threatening, but we had an individual in the factory who cut her finger off. And that one was just trying to keep her conscious and not see what was going on with her hand. And the thing that was ironic about it is because in dental, we're used to blood. It doesn't bother us as long as it's somebody else's. Right. So we knew what to do. But all of the other first responders that were helping me, they're like, I can't do this anymore, Jackie. You've got to take over. Wow. And they were stepping away because they couldn't handle the amount of blood we had. Gosh. So it's not always CPR as much as it's knowing how to keep yourself calm, do what you need to do, save, protect this individual, and then you can go to the other room and lose conscious
Well, and
with yourself.
especially, I teach this in our class, especially if that victim's loved ones are around, that's when it
Oh my
gets
gosh.
really complicated. So if you have other people to help you, the very best thing to do is have them take those people away from the scene. But keep them occupied. Ask them, do they have a history of heart problems? How old are they? Are they on medication? They'll feel like they're doing something to help the situation, and then they're away from the scene where, if they get in the way and start touching the victim while you're using the defibrillator, it all
Right.
wastes time, and you can't waste a second.
Yeah. That's
Freaking
good
family, man. I
guidance.
tell you what, aren't they just like the root of all evil? This
Right.
family.
Right.
I had a patient who her water broke in my chair.
Interesting.
Yeah. And the most interesting part about it was this is for her third baby, so we knew it was going to come fast. The good news was the hospital was right down the street, and this was before cell phones, and they couldn't get a hold of her husband, so our receptionist drove her down to the hospital. But she had her 2 other children with her who were not the most well-behaved children in the world, and they spent the day with us while their mother was in the hospital. So yeah, I'll never forget that one.
Thank goodness for the little treasure box, right? The little
Yeah.
treasure chest.
Go pick a prize.
We had, I remember like one, I don't think it was a failure necessarily on my end, but it kind of was a little bit of a failure. But there was just classic syncope, right? Fainting in the chair behind me. And I had like the ultrasonic going at the time. And the dental assistant was yelling for me, but I didn't hear it.
Oh.
And then later on, she's like, Andrew, I was calling your name and you didn't even, you ignored me. I'm like, I swear I didn't hear you. I'm so sorry.
Yeah.
Are there any like emergency situations that either of you are like, I don't want to deal with that. I'm too scared. Like I'm not qualified. I'm not trained enough for it.
I think the only thing I think about in the back of my head is if it happened to a close family member, would I be able to do what I need to do?
Yeah.
I mean, I think I would, but it's different. I've been in situations in the public where I've had to perform CPR and, but if it's, my parent or, my child or something like that, I think it would be harder. So I think about that, but no, otherwise I don't think there's anything. I'm usually ready to jump in.
Yeah, I can't think of any scenario. I know we came up on a car wreck once upon a time, and both of the passengers in the car were deceased. And that was harder than trying to save somebody, because then you're trying to figure out what to do. You're trying to protect the deceased privacy while all of the other cars going by are gawking and wanting to see. And so there were us and then 2 or 3 other cars. I can't remember for sure, but everybody's looking for blankets and such in their cars to cover up the windshield of the car.
Yeah.
So that was probably more disturbing than trying to, save somebody.
Right.
You talk about saving a family member, and I think you probably it's that adrenaline. You would jump in and do what we know we need to do.
Right.
And then you fall apart and cry afterwards. But that was harder than trying to save somebody, is how to respect the deceased's, privacy.
I think that's right up there with my worst like fear, like just coming upon something that's, there's nothing that you can do. And just, I don't like to look upon that situation. Like I can look at, their guts could be spilling all over the,
Sure.
I'm good with that. Like I don't care, but just like, there's no life in this body. Like that makes me so like, whoa.
I've been on an airplane a couple of times where people passed away. You have to, they just put a blanket over you.
Oh, wow.
I read an
know.
article about that. I didn't know anyone's
wow.
ever seen that before. Interesting.
Yeah,
I mean,
and
do they
the
move
first
to a
time
new
I was,
seat?
no. And if the plane is full, you're sitting next to that person. And, a lot
What?
of bodily things happen,
Right.
when you pass away. But
Yeah.
the first time I learned about it is I was getting off a flight and there was, a person there and there was a blanket over him. And I thought, do they need to wake this person up to get off the plane?
Yeah.
And then I learned that they
Wow.
had passed away on the flight.
Yikes.
I had
It's got to happen, obviously.
I
but
was
still.
on a flight, and a young lady passed out in the aisle, face planted, face first.
Oh, gosh.
Of course, the flight attendants are asking if anybody, on the flight knows, has any medical experience. And it was right in front of me. So I jumped up and set her up in the aisle. She regained consciousness, and I got talking to her, and I could smell. And I said, "You been drinking last night?" And she goes, "Yes." I said, "Did you have breakfast or water this morning?" No. So we did what we needed to do and, got her some food and water and got her back in her chair. But I got a free plane ticket out of that.
Oh.
So if
Oh.
you get asked to take care of somebody on a plane, jump right in there.
Yeah, that happened to me. We were on our way to England. We were halfway across the Atlantic Ocean, and a gentleman had a heart attack. And so they started CPR, and there were enough flight attendants that they just kept rotating in because I offered to help, but they said no. And they had to decide whether to keep going or turn around and go back. And so they turned the plane around and went back to Boston. So this was a good couple of hours they were doing CPR on this poor guy. And we landed, they got him off, and they radioed back and said that the guy had a heartbeat. So I don't know whatever happened. But that was
That's
truly
incredible.
a miracle. Yes.
On planes, do they not have AEDs?
They do, but this was a long time ago and they didn't
Okay.
then, but yes, they do
They
now.
do now. Okay. I can only imagine just start lining up all the passengers. All right, everyone's
Okay,
going to take a
your
turn.
turn.
Right.
You've seen us all doing it enough. You just
Right, you
repeat
know
what
what
we
to do.
did. Yeah. Tag.
I think there's the medical emergency where there's like, not like just like decapitation, but like some sort of like a severed limb is something that I'm going to actually cut that part out because I got too dark. And all of a sudden I went to a different place.
Well,
I
I
don't
do
wanna
have a
talk
funny
about
story
severed
about
limbs.
that. When Jackie was talking about the finger getting cut off, I also teach first aid.
Yeah.
And in our first aid video, they go into what happens if with a limb. And so you're, supposed to wrap it up and, put it in some ice, but put it in a bag and then put it in another bag with the ice and keep it separate. But then part of the video says, and write their name on it. Like, who else is
Just so you know who it goes to.
Right.
In case there's six
gotta
people
be-
in the
It
ambulance
just
missing a
I say-
foot.
cracks me up.
It's got to be for like the hospital later on to be like, okay, we have our thing of ice over here. Which body part goes to which person?
Right. But there was a television episode one time on, I forget, one of those emergency shows, and it was a bus accident, and they did put the wrong foot back on.
Oh my gosh. Was it
But
the-
yeah,
was it
we're
the left
going in
foot
a
and they have two
crazy
left feet
direction now. But
Well, I was driving up through Atlanta one time, and I think this is where I made a mistake in handling the situation, but we stopped to get gas. I was with the kids, and this lady in front that was at like the checkout counter all of a sudden just fell over, and she started kind of like shaking. And in my mind, I'm like, okay, maybe a seizure, right? So I'm going to go ahead and I'm going to look around first. She was a little bit bleeding from the mouth a little bit because she'd bit her tongue or something. So I'm like, okay, this is classic seizure. So I'm like, okay, so we move like the end cap thing over to the side, and there was someone else that had come on later on. Then she was a paramedic off duty, and she's like asking all of the questions to the husband that I had asked the question like, does she have a history of all this stuff? What I didn't ask was, when was the last time she ate? All of these things. And it ended up being a diabetic episode.
right.
And I totally missed all of the signs for that. So I felt like a little bit foolish where I'm like, okay, do I need to be jumping in and helping people if I don't have all of the things? So going back to your story of like, you've been in public administering CPR. Like, how do you get over the fact that you may or may not be qualified?
Yes, you have to just get over that, and you have to be
You just have
okay
to do
with
it.
it. Yes,
Okay.
because
Great advice, Debora.
because maybe that wasn't the right way to put that, but because this is a horrible situation, and you're not qualified, but you are the bystander that's there, and all you can do is what you know how to do. So the main thing is to make sure that that person is safe, get EMS coming as quickly as possible, and then whatever knowledge that you do have, it's mainly just keeping them safe, keeping them breathing. Your CPR. Anything else, you can't think that you would be able to diagnose it, and that's what where a lot of people think, well, why did this happen and how, you don't go there. You just deal with the situation that you have on hand.
I like that. Kind of like relieve yourself of that burden.
Exactly.
It's not on you to do that.
Right. No.
What are the common mistakes that people make during CPR administration?
The biggest one when I'm testing them, but I don't think they would do this in real life, is they forget to call for help. They're so focused on, I need to check their pulse, I need to get going. But in real situations, I think you're going to be screaming your head off. So, I don't really worry about that as much when I'm checking people off. The other thing that people mess up sometimes is the numbers. Years ago, they kept changing the numbers on us, but now it's been 30 and 2 for a long time. But then if you have 2 or more responders for infants and children, it switches to 15 and 2. So people do get that mixed up. But at the end of the day, that really doesn't matter either. As long as you're doing something, it's better than doing nothing at all.
All right, I'm going to wrap this up in a minute. Jackie, you have any questions or thoughts for Debora Carrier?
No, I guess I just need to get on your list and get my
There you
CPR renewed.
So let's talk about that for a quick minute, though, because I think during the height of COVID, when I moved over to Florida and I wasn't affiliated with any offices, I didn't know any providers. A lot of providers actually weren't even offering courses at the time. You really kind of bailed me out. So I kind of wanted you to maybe explain a little bit about what you do and how someone, if they're in a similar situation to me and they need a renewal, like how do they do that?
Well, we really have CE Zoom to thank for this. And Sarah had been bugging me forever to give her an online course. It was the only thing she was missing to have the whole package for all her clients. But we weren't allowed to do CPR online. Then COVID hit and American Heart released these guidelines that says, yes, you can do it, remotely or virtually. So Darla and I cooked up this idea of how we could make it work, and we weren't sure how it was going to go. So the way it works is you go on CE Zoom, you sign up, and we do a 90-minute class, and everybody just joins the webinar, and I do all the demonstration. When that class is over, you go online and you take...
It's a live class. So I want to clarify
it's live.
that. Yep.
And then after the class is over, you go online, you take the written test. As soon as you're done with that, you send us your shipping address, and we mail you a whole kit that has an adult mannequin, an infant mannequin, a bag mask, an AED, all the supplies that you need. We mail it to your house, and then you sign up with us for a 10-minute Zoom call, and you demonstrate your skills. And we had no idea how this was going to work, but everybody is learning better this way because it is absolutely one-on-one, even though it's not, quote, in person. Most of the time, especially in dental offices, you take CPR at the end of the day, the whole office is there, and half the people don't even touch a mannequin. They've never touched an AED trainer. With this, you get the kit. You can keep the kit for a week. Well, you did. Yeah, you can keep the kit for a week. Your kids can play with it. You can do whatever you want. And then when you feel ready with your skills, and we send a video of how to put all the equipment together and all that good stuff. And everybody has said, in the 20 years of me taking CPR, this is the first time I feel very confident in what I do. So I'm hoping they don't pull these guidelines away from us because we are seeing... I'm gathering all our testimonials because I have a case with the AHA if not, because I think it's a way better way for people to learn.
I think part of it, like the mannequin's not just some chintzy little thing. Like,
no.
In person, you can kind of see if there's like a complete seal, right? But virtually, it's a lot harder, right? But then there's like the tools within the mannequin. You can see the chest rise. You can do all of these different things.
And our mannequin has a light, so if you're not doing your compressions correctly, it's red instead of green, and
it's a very nice high tech. I really also appreciated the infection control parts they put in, like the wipes and the things, and a bunch of disposables for everyone. And so I didn't feel like, oh man, where was this mannequin before? Was it at Jackie's house last time? Nobody wants this.
I know. And the other thing too is a lot of people get nervous taking CPR. A lot of people do.
Yes.
And if they have this at their home and they can practice as long as they need to before they get on a call with us, it really helps them to learn better.
Which I definitely did practice several times before. And you don't have like a teacher. Oh, well, actually, what's worse? It wasn't the teacher. We had a firefighter that would come and teach all 40 of us in our clinic. It wasn't so much them watching it. It's like your other hygienist next door. Like, they're like, oh man, I hope it's not Andrew that has to deliver this because he is messing up on those compressions a lot. Dude doesn't even know how to count. Like, that's bad. And so I felt like, I really was able to, be confident in doing it. And you make me nervous because we're friends.
Right.
And I'm like, whatever. But like, it wasn't so bad on the Zoom call. Like, I felt like, oh, let me demonstrate my skills. I know what I'm doing. And that was good.
Yeah, you might be getting more qualified results.
Yes,
I mean, because there isn't
absolutely.
that nerves and because we've all done it in an office with all your peers and your colleagues watching you, and it turns into a big joke because you're so uncomfortable. So this is,
and everyone's singing "Staying Alive" at the time, right?
Yes, exactly.
Yeah.
And then there's no one singing.
And there's
seriously.
always that one that's off tune, so it's just annoying.
Why are you looking at me? You stared right in my eyeballs when you said that. I can hold a tune, okay?
Well, I just heard you sing.
Oh, sorry, listeners.
Sorry, Andrew.
I take that back. You know, I'm going to edit the part where like I actually sang and it just make you sound so terrible. Like you're just attacking me. I'm a victim here, everybody. I'm a victim.
You play it so well, though.
Yes, thank you. All right, Deborah. So if anyone is interested in taking your course, where can they go?
Well, they can find us at CPR Sisters, or just go to CE Zoom and sign up for one of our classes, or just, find me on social media and get them signed up.
Awesome. Thank you for being here.
Thank you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.